Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I have Dr. Lou Baptista. Dr. Baptista is the Chief Wellbeing Officer for Columbia University Irving Medical Center. He's also the Executive Vice Chair for the Department of Psychiatry at Columbia University. So, Lou, I just want to thank you so much for joining me today.
Of course. Good morning, and thank you so much for the invitation. It's a pleasure and an honor to be here with you.
Aw, thank you. The pleasure is truly mine. So now, but before we get into all of the amazing work that you're doing at Columbia, I was hoping that maybe we could talk for a few minutes about the changes that you're seeing in mental health over the past few years. You know, when we first met, it was before COVID, and we were already trying to strategize how you could help our population of patients really manage their mental health better. And I can't even speak to the changes. I wanted to hear a little bit from you about what you've seen since that time when we first met.
Sure. No, thank you for the question. I think it's a very important, foundation for our conversation. And I recall our initial meeting a few years ago prior to the pandemic and the growing concern about, the needs of the community regarding mental health, particularly the youth. And I think the reality is that we had been seeing already an escalation of acuity and complexity and problems with access when it comes to mental health, particularly for the youth, population. And I think everybody has experienced that. And I think we're able to validate that in a way that was predictable, that the pandemic just accelerated and amplified. Mm-hmm. So I think this post-pandemic phase, we clearly are seeing the effects of this several years trend now of increasing needs for mental health for the community, then the impact of the pandemic. And that together has really created a very challenging situation. And I would even qualify as a crisis.
Yeah.
I think especially for youth, I keep going back to youth because, the kids, our young people, our adolescents, they are the foundation of our society. And if we can't protect them, what does it say about us, right? So I think there is a crisis about mental health in the country, and certainly I think is impacting, kids and adolescents in a more severe way, the way I see.
Well, you're certainly preaching to the choir here as a pediatrician, right? And it's interesting because even in pediatrics, we're seeing such a change. Our bread and butter used to be earaches and, runny noses. And now, if you don't know how to manage anxiety and depression, you really can't function in the pediatrics office. Yeah. So, and then the other piece is that, access is so different depending on what insurance you have.
Absolutely. And that has been an issue for a long time, right? I think, unfortunately, access, there is significant, amount of inequities and disparities in terms of access to health, particularly mental health. And I think the payer mix, the insurance, is a significant factor.
Yeah. Okay. So are you seeing the same sort of crisis in your employees and your house staff? And tell me what you're seeing in the hospital.
Yes, no, I appreciate the question. I'll start by saying that, here at Columbia, we made a commitment about 5 or 6 years ago. About 6 years ago, our own mental health services did not take Columbia employee insurance. And we made a commitment about 5 or 6 years ago that will be the core of our mission moving forward, will be to take care of our community and defining our employee as our immediate, community. And over the last several years, I mean, it is both, a sense of pride for us that the majority of our patients right now in our Columbia faculty practice services are Columbia employees, about 70%. It's also a challenge because, mental health, the sustainability of mental health services in academic medical centers is very, very challenging using insurance. So we are in that kind of, conflict of being 100% committed to the mission of taking care of our own people and struggling to sustain the programs because their income from insurance is not enough.
Wow. I mean, it's just, I'm speechless. It's just such insanity. Ah, all right. So what are you doing? And this, you guys are very forward. I mean, I became this chief wellness officer person for Allied just this year in 2023, but you guys have been in the wellness arena for quite a bit longer. Tell me what your role is and how you're addressing these issues.
Sure. Yeah, so like you, I was given the opportunity and the challenge, to take this on, take the well-being enterprise or effort for Columbia Medical Center. And that was also a product of the pandemic. I think pre-pandemic, there was already some attention and discussion amongst physician groups at Columbia, and certainly that amplified during the pandemic and really expanded beyond physicians. So our approach, which is a little different than most academic medical centers that are investing in well-being, is not restricted to physicians. It's really including all Columbia Medical Center employees, physicians, scientists, but also the support staff. They're critical for the functioning of the medical center. So altogether, it's about 13,000 people. And again, this is both, I think, a great opportunity but a challenge because there's not a real roadmap that we can follow. There are great and terrific conceptual models that have been developed and suggested, and we're definitely using everything that we can find that seems to make sense. At the same time, there is not enough evidence in terms of the execution, what really works and how to measure it. But we're taking that on, and I think we're taking this with a lot of humility and honesty that there are a lot of limitations. We're going to need to use the data and the evidence available that is limited. We're going to have to learn through our experience with shortfalls and small successes and build the blocks. And that's how we started. We started by creating first the position of a chief wellbeing officer. Initially, it was for the physician groups. Then that was expanded to the entire medical center, including staff in the 4 schools that comprise the medical center. And then the creation of that position led to the creation of an office of well-being for the medical center that came with some infrastructure, a budget, and a team. So we have a terrific team, and I give all the credit to anything that it's happening and will continue to happen actually to the team and everybody who is involved.
That's right there. That shows what an amazing leader you are. Giving all the credit to your team. That's great.
No, thank you. But I think it's also the core of what we believe might be the success of well-being or wellness efforts, is that at the end of the day, sure, we do need to have top-down support, right? We need to have commitment and modeling and support and investment from the top. But at the end of the day, I see this as very similar to quality, right? We can't, give the responsibility of quality for one person. The quality director does quality, nobody else does quality. So we all are accountable for our work environment, for our culture, for our collective well-being. So it has to start somewhere, but at the end of the day, it is a collective and team effort.
Yeah. So what are you guys doing on a practical level? Because, there's supporting the well-being on the personal level, helping build the resilience skills and all that stuff. But then there's really the more, I think the more pressing issue, which is on a structural level and an operational level, to really remove those barriers and make life a little bit easier for the healthcare workers, whether it's the, doctors or the nurses or whoever. How are you addressing that?
Yeah, you're so right. You're so right about that. I think one of the challenges of getting to the well-being business is that it's very easy to stay in the clouds, right?
Mhm.
And spending a lot of time and effort debating which conceptual model, which, balloons and
Mhm.
domains fits the best. But then the jump to execution, I think normally is the major, major challenge. So what we decided to do is, start relatively modest and build. So we're focusing our year one of the well-being office, focusing in three main areas. One is definitely, developing what we call a communication strategy, which is basically we need to have a common language,
Mhm.
right? If we all thinking and talking about well-being differently, it's going to be much challenging to try to implement or execute any form of plan. So one is developing a common language, developing a consistency. When we're talking about well-being at Columbia, we have a similar understanding. But also, how do we use communication as a tool? How do we use communication not only to bring awareness and do some marketing about the office and the resources, but how do we use communication to inform, engage, inspire, support, and improve access to resources. So communication is critical, and we're really working very hard and closely with our communication department on that. The second bucket is metrics.
Hang on,
We
before
need,
you move on, is your communication um, just top down? Have you built channels for bottom up communication and to assess whether or not there's trust from the people on the ground?
yeah, no, these are excellent questions. So we're partnering with the medical center communication department. So we rely on them in terms of the execution of our plan. But right now, what we're trying to do is one is developing a context and a synergy with the communication that comes from the dean. So
Mhm.
there is a integration in the overarching communication top down, about well-being, about workplace experience and validating people. So the other one is our own communication from the office that is underdeveloped. For example, we're developing, let's say, a newsletter that will be regular, be a cadence that will include you know reminders, will include a calendar of events and workshops and how to access the resources that we currently provide, including mental health, as well. But there's so many other different ways of doing, and I'll talk a little bit more about it, what we currently developing too, because we realize that top-down centralized communication alone is not effective. So we actually trying to provide the tools, including a communication framework to each individual department. So chairs and leaders within the department have a framework of how to effectively use communication with their teams, right? Because it has to be localized at the end of the day. So
Right.
we're using a central strategy, but also providing a similar framework that can be utilized at the local level on the
Mhm.
communication front.
Right. And I interrupted you. You were about to go to the second part.
Yeah, the second part is metrics, right? And I think we need to have, without metrics, we go blind, right? We
Right.
go, well, we think we call it intuition, right?
Mm.
But this is not always accurate. So we really needed to have established some baseline metrics. And in November, this past November, we released the very first COMC-wide well-being survey, and
Mhm.
was released to all 13 plus thousand employees, faculty, and staff. And it's been a great learning experience. I think we use a validated scale using the well-being index that measures well-being and levels of distress, and to establish a baseline. And we had, a compilation of validated climate and cultural questions asking about respect, asking about civility, asking about different moderators of workplace satisfaction or dissatisfaction, and was very helpful. And we produced that data not only at the medical center level, at the school level as well, but then at the departmental level.
Mhm.
And we use that data to establish the baseline, but also to create a space to engage conversations. And since there, we release a report, we have met individually with every single clinical department at the medical school with their chairs and departmental administrators, not only to review their own data, but then to agree on moving to the next phase, which we are in the middle right now, which is developing a local well-being action plan for this coming year for each individual department. And that plan will be then anchored on the survey data, on the individual context of each department, right? Because let's say the workflow, the reality of, physicians that work in the ICU, it's very different, right? The physicians that are working in the faculty practice in Midtown Manhattan. So, so we can't approach this as a one size fits all. Right. So, and that was actually, one point that all the chairs became very eager, is really how they can really, get some assistance and direction and partnership to develop their own local action plan. But it's helping us also engage the leaders at the local level and customize the plan. We also developed.
When you empower them, you engage them, and that's great.
And they are driving, right? They really, in addition to the survey data, they are educating our team on the main issues affecting their staff and their faculty, and we're trying to integrate that in the plan. And the team our well-being team developed what we're calling right now a well-being best practice toolkit for leaders. So we did a lot of research and trying to extract, some behaviors and concepts and packaged together in a few buckets. And we're providing that as well. We're publicizing that. So we're using the data, we're using the local context and input, and then we're using the toolkit and helping them produce their very own, well-being action plan. So it's going to be our very first attempt to have organizational level buy-in and engagement. And we are about to start doing this with the basic science departments, which is another journey completely different from the clinical world.
Yeah. So you're creating sort of the framework, and then each department is going to create its own local implementation. I'll be so excited or interested, I should say, to hear what some of them come up with.
Yes, no, and I think will be a great opportunity for our team to learn, right? Yeah. Because I think a lot of it is for us to be able to create those spaces to listen and learn. And we're validating the fact that we have in these meetings now, each department, we asked them that they nominated a small work group locally to then work with our well-being team to develop those plans. And we are seeing a pattern that, a lot of the departments are using these spaces to vent, to talk about, right, the triggers or the pain points. And that's totally fine. I think it's another way that we have to understand their reality of what impacts their lives day to day.
Right. Well, you have to identify the pain point to come up with a strategy, right? So that's the first step. The last time we spoke, you mentioned something about a slightly different approach that you were taking in terms of training and engaging the use of health coaches, which is an area near and dear to my heart. And I was hoping you could speak a little bit about that.
Yes, no, thank you. Thank you for bringing that up. Yes, I do think we believe strongly in peer-to-peer mentoring, peer-to-peer support. And very often, we create expectations for performance without providing the tools. So we really wanted to be able to provide tools, to our peers so they can actually support and hopefully exponentially spread out through the medical center. So this idea was actually not our, Columbia idea. We really learned that from colleagues from Mass General. And Mass General had been sending physicians, mostly primary care physicians, to be health and wellness coach certified. And in a series of conversations with our colleagues there, we thought that was something that we wanted to try. And we partner with New York Presbyterian in sharing that cost for this pilot. And in 2 weeks from now, we're going to have our very first cohort of 10 physicians from 10 different departments that we will start this training. And, it's 3 modules. The first module is in person. We're having here at the medical center to bring the group together. And then module 2 and 3, self-paced and online. And we're hoping to really learn from this experience and perhaps using these 10 physicians to develop then an internal curriculum that we can then, disseminate through the medical center. But we're very excited about that, and as are the physicians.
Yeah, and I have to tell you, I am stealing the idea and trying to implement something similar at Allied for next year as well. Are you hoping to use it also for the patients?
Yes, no, it's a great question, and absolutely. And that's one of the experiences that we learned from our colleagues from SGeneral, is that they have been able to integrate that not only on the well-being side of things with colleagues and employees, but also in the clinical practice.
Yeah, it's a win-win, right?
Absolutely.
All right, so I guess I should ask you how you, as yourself, and you have all of these things that you do, are you still seeing patients, by the way?
I do. I have Thursdays are is my clinic day. So I see patients on Thursdays, and the rest of my time is, my administrative work in psychiatry and my work in well-being.
All right. So what do you do personally to keep yourself grounded, centered, well, whatever the...
Right. Now, it's a great question. And I think it's so different from person to person. I think for me, I swim. So I was a swimmer in high school, and after a 25-year break, I went back to swimming a few years ago, and that is my became my lifeline in terms of health maintenance, but both physically and mentally. So physical activity primarily, swimming is a big asset for me, but I rely a lot on my colleagues, especially in the workplace. I think that is so important, to have that network, and create that culture of mutual support. So I learned significantly during the pandemic. And one of the things that I did not do before the pandemic that I do it now is practice gratitude. So I constantly remind myself of, the great things that I have and the people in my life, even in the tough days and the difficult situations that we are in. So, so practicing gratitude has also been a new asset that I've been trying to utilize.
Yeah, I started actually doing that a few years ago, and you think it's like, what is it? But it's really, what do they say? What you focus on grows.
Yeah.
And the actual act of paying attention to those little things, it's like, I honestly can't believe what a difference it's made in sort of my baseline mindset.
That's right.
Yeah, thank you for sharing that. Before I let you go, because obviously I think you're from Brazil, correct?
That's right. I was born in Brazil.
Do you do anything in particular for in your patient population with the Spanish-speaking community? Do you have a lot of Spanish-speaking patients?
Not anymore. My first 6 or 7 years at Columbia, my clinical work was primarily at the hospital that serves the Washington Heights community. Is a primarily Hispanic community, and I trained in adult psychiatry at University of Miami. So I was very, comfortable in terms of, providing care, in Spanish, and I did that for my first 6 or 7 years. As I moved out of the hospital to a more administrative role in the hospital, my clinical activity migrated to the faculty practice, which is primarily university employees. So I don't have as many, Portuguese or Spanish-speaking patients, right?
Yeah, the Portuguese is, Oh, well, too bad. It's such a needed, so needed. And, I also notice you do, I don't know how you find the time, but that you have some volunteer, like you're on the board of a hospital and you have this leadership academy. I don't know how you do it all. Do you sleep?
No, I actually do. But I think I'm one of these people. I think there's a lot of people, I would suspect you're probably like that as well, that I actually like and I need to be involved in different things. Right. So I think that keeps my energy, keeps my focus. And I think when we add missions, and I have these different missions that drive my life day to day, that's actually very helpful to me.
Yeah. Oh my God, that's such a great way of putting it. And I agree with you, but people have different things that drive them, right? So I can always feel like, oh yeah, if I get into a routine, I need something new to kind of re-energize. Yeah, that's very true. I guess we are cut from the similar cloth. Okay, so tell me, you at Columbia, you have a great place. How can people, if want to join you or find out more?
Yes, no, thank you. I think at the end of the day, when we call it well-being, is really a holistic people strategy. Is really investing in people in a holistic way, starting with how can we attract and recruit the best people, how we can retain and so we can develop them, and developing a work environment that is healthy and people can flourish together and celebrate each other's success. So of course we're always in the lookout for talent, and we want people to know that we are meaningfully invested in people. People are the core of our investment right now. And I have to give a lot of credit to our Dean Armstrong, Katrina Armstrong, that has really been behind our well-being effort, that at the end of the day is really about investing in people. So people should feel free to reach out to me. My email is lb2602@cumc.columbia.edu, or they can call 646-774-5365. Email, calling, any way that you can reach me. I'm happy to have a conversation.
Oh, that's so kind of you. And yes, the place is nothing without the people. The people make the place. So I like that shout out. So Lou, thank you so much for joining me today. It really was a pleasure seeing you. I can't wait to hear the next steps of your development.
No, thank you. Thank you so much for inviting me. I really enjoyed the conversation, and I look forward also to continue to learn about the amazing work you're doing.
Oh, thank you. That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.